fraud in a second, which is also a part of it. But the Aetna, led by Mark Bertolini, has said, listen, here's what we have to do. We don't want to cut Medicare and its recipients. We want to take the inefficiencies and waste out of the system. The rest of the industrial world spends about 8 to 9% of their gross domestic product on health care. Most of those countries have universal health care for all of their citizens. Now, some will be quick to point out, yes, but they don't have the surgeons and they don't have it. That is true. We have the greatest system, we have the greatest surgeons, we have the greatest hospitals. We also have the greatest inefficiency of any system, which presents us with a golden opportunity. Paul, Ryan, and I both agree on this. What is the cost that's driven our deficit? Healthcare related costs. Yes, it's true that the military, do you have a water or anything? That the military costs and 2 wars that are unpaid for have driven our costs up. But primarily our costs have been driven domestically by the most inefficient economic system around healthcare that's resulted in 18% of our GDP. Most other countries, 8 or 9%. Switzerland, I believe, is the highest. They're at 11. Hear this. If we drive costs down below 14%, that's just dropping them by 4%, right? We not only can pay off the national debt, put people back to work, expand Medicare, make it solvent, but we can do so without raising taxes and preserving Medicare. So why aren't we doing it? Because we're in this endless tastes great argument, less filling argument in the United States Congress instead of sitting down and working this out for the American people. Every time I go home, citizens will say to me, what is it? Why can't you guys sit down and work this out? Well, now here's a face-saving alternative for everyone. For my Republican friends and colleagues, you don't have to raise taxes to achieve that goal. We just have to get the efficiencies, get after the 700 to 800 billion annually. And then we'll focus on the fraud and abuse also. But that occurs. Quite doable and achievable, and also will allow us not only to make sure that Medicare is solvent, but expand it and allow bridges that will allow people to pass over without fear that they'll lose their homes, their mortgages, or if they get sick or ill in between the time they go from their job to they reach Medicare, that their government has their back. I thought that's why we formed a more perfect union amongst our people, and I think all of you believe that too. And I think Americans believe that. These aren't Democrat or Republican ideals or values. These are American values. Taking care of one another and doing it in the most cost-effective means possible. And here we are presented with this chance. Now, mind you, the Affordable Health Care Act cost $954 billion over 10 years. Conservatively, as all these studies point out, there's 750 to 800 billion annually in inefficiencies that can be wrung out of the system. Annually. So this can not only be paid for, we can drive those costs down. And if we drive those costs down, there is no debt ceiling issue. There is no sequestration that exists in Congress. In fact, it gives us room within the budget to do more infrastructure work, to be able to rebuild our country, our roads, our bridges, our airports, our deep harbors, our school systems, the levees that protect our 2 sides of the river here between Hartford and Windsor and Wethersfield and East Hartford and South Windsor and Glastonbury, all of which are important and things that we need to get after. That's what we ought to be doing. Democrats ought to be big enough to say, look, We're not going to get there by taxing the nation's wealthiest 1%. Not that it's not the right thing to do, or that they're not in a position to be able to do it, but we don't have to do it, and we can't achieve everything that we'd like just by that. Nor should Republicans be saying, we need to voucher, we need to end Medicare as it is. So let's admit that both sides probably got it a little bit wrong, and let's get together and do it right for the American people. Let's do it right for the American people, and do it in a way that we reach out and take the best of public health, the best of the private sector, and all that science and technology can bring to bear. I'm proud of our insurance companies and how they're going to lead the way on this. I'm proud of the example that they're going to be setting. We need to follow that example in the Congress and sit down and say, this can work. This is how we need to get there. Now, 18% of GDP is trillions of dollars of waste and inefficiency. You know how much a percentage of GDP, because everybody's concerned about the national debt, and they should be, because people don't want to pass on debt to future generations. So this is a good cause. People who came to Congress, Tea Party, conservatives, Democrats, whatever, whose goal was we got to reduce the deficit, that's a good thing. That is being tackled forthrightly. What percent of GDP is the deficit? Does anybody know? It's currently 4%, but with the cuts that are being made now, currently next year it'll be at 3.4%. The deficit in terms of GDP expenditure is 3.4%. Healthcare inefficiency, 18%. You see what I'm talking about in terms of driving that inefficiencies down, and that levels the spending curve in terms of where we're going with the nation, and helps us on so many fronts. This is all doable and achievable. And so we're having arguments over repeal or non-repeal, and making, taxing other people and penalizing Medicare recipients or restricting them. How does that make any sense? So we got to get behind this president and get through what I think is going to be a difficult time, but persevere. This law has been upheld by the Supreme Court. It's gone through the process of a presidential election. It's gone through a lot of fits and turns, and there's a lot of work that still needs to be done. A lot of work that needs to be done. The bill is not perfect, and no one should say that. But for God's sake, it's got us going in the right direction. And if we embrace the things the way that we should, as we traditionally have as Americans, this will work. This will be successful. And it will help us on several fronts to both drive down the deficit, refocus the effort on patient wellness and patient care and patient outcomes, and in the process, employ more people in that field as we begin to coordinate care in a way that we haven't before. I say the coordination of care, and I mean that if we can't link together all the genius of the Mayo Clinic, the Cleveland Clinic, Sloan Kettering, Boston's Children's Hospital, Hartford Children's Hospital, Jackson Labs, all of these great institutions that we have, in a way that we produce the most efficient and effective system, then shame on us. If we spend all of our time arguing in Washington over things that mean little to people, instead of impacting their lives in a meaningful way as it affects both their pocketbook, but as importantly, their wellness and their family's wellness. That's what I'm going to continue to fight for and work for down in Congress. Now, I'm happy that Access Connecticut is here, and they're going to be able. And they have. There's a couple of brochures that we have, or many brochures that we have, but including one. One is a warning. I think you sufficiently got it from me about. Do not, if you're on Medicare, let anyone tell you or take any information with you, and I'm going to conclude with this, because of the theft and the fraud problems that we have in this country.